Ever wondered how chronic pain affects your daily life and what you could do to manage it better? In our world of constant hustle and bustle, chronic conditions like arthritis, joint pain, and inflammation can often feel like uninvited guests, overstaying their welcome and impacting our quality of life. Traditional treatments can sometimes fall short, leaving us searching for more. But what if I told you there's a light at the end of this tunnel? Quite literally, a red light. This is where red light therapy comes into play, a promising alternative method that's been gaining attention for its potential in pain management. It's not just a trend, but a scientifically backed approach that's starting to reshape our understanding of healing and pain relief. So buckle up as we journey into the fascinating world of red light therapy. Today we delve into the science and benefits of red light therapy for chronic conditions. Let's illuminate the path to a life less hindered by pain. Before we proceed, let's understand what chronic conditions are. Chronic conditions are health issues that persist over a long duration, typically over 3 months. They often involve pain and discomfort and can significantly impact a person's quality of life. Some common types of chronic conditions include arthritis, joint pain, and inflammation. Arthritis is a condition that causes pain and inflammation in one or more joints. It's not just a single disease, but a way to refer to a group of more than 100 different rheumatic diseases and conditions. It can affect anyone, regardless of age, and it's a leading cause of disability in many parts of the world. Joint pain refers to discomfort, aches, and soreness in any of the body's joints. This condition isn't usually a critical one, but when it becomes chronic, it can be debilitating and significantly affect a person's mobility and quality of life. Inflammation, on the other hand, is the body's natural response to injury or disease. It's a necessary part of the healing process. However, when inflammation becomes chronic, it can lead to various health problems, from heart disease to cancer. Traditional treatments for these conditions often involve the use of medications to manage symptoms. These can include pain relievers, anti-inflammatories, and in some cases, stronger drugs like opioids. While these treatments can be effective in managing symptoms, they often come with their own set of challenges. Many of these medications can cause side effects, from mild issues like nausea and fatigue to more serious problems like addiction or organ damage with long-term use. Moreover, these treatments are often only managing symptoms, not addressing the root cause of the chronic condition. This can lead to a cycle of ongoing pain and discomfort, with the underlying condition continuing to progress. This is why there is a growing interest in alternative therapies that not only manage symptoms but also address the underlying causes of these chronic conditions. One such promising therapy is red light therapy, and it's not just a few individuals struggling with these conditions. Chronic conditions like arthritis, joint pain, and inflammation are incredibly common. According to the World Health Organization, non-communicable diseases, including chronic conditions, are responsible for almost 70% of all deaths worldwide. That's more than 40 million people every year. Behind these numbers are real people, dealing with real pain every single day. It's the mother who can't pick up her child because of her arthritis, the athlete sidelined by joint pain, the millions suffering silently from chronic inflammation. And that's why we're here, exploring alternative therapies like red light therapy that could potentially bring relief to millions affected by these chronic conditions. These conditions are more common than you might think, affecting millions of people worldwide. And with every person that finds relief, we take one step closer to a world where chronic pain doesn't have to be a life sentence. Now let's explore the science behind red light therapy. Red light therapy, also known as photobiomodulation or low-level laser therapy, is a non-invasive treatment that uses specific wavelengths of light to stimulate the body's natural healing processes. But how does this all work? Picture this. Our bodies are made up of trillions of cells, each with its own job. When these cells are exposed to particular wavelengths of red or near-infrared light, something remarkable happens. Inside our cells, there are tiny powerhouses called mitochondria. These mitochondria absorb the light, sparking a series of metabolic events. The primary event is the creation of a molecule called adenosine triphosphate, or ATP for short. ATP is often referred to as the energy currency of the cell, powering everything our cells do. The production of more ATP means cells have more energy to repair and rejuvenate themselves. Now let's talk about the wavelengths. Red light therapy devices emit light in the red and near-infrared spectrum, typically between 600 and 850 nanometers. The red light, at the lower end of the spectrum, is absorbed by the skin's surface layers, making it effective for skin health and healing superficial injuries. Near-infrared light, on the other hand, penetrates deeper into the body, reaching muscles, joints, and even bones. This is why it's often used for pain relief and inflammation reduction in conditions like arthritis or muscle pain. So, what does science say about all this? A growing body of research supports the efficacy of red light therapy in managing chronic conditions. For example, a study published in the Journal of Pain Research in 2020 found that red light therapy significantly reduced chronic lower back pain. In another study, published in the Journal of Physical Therapy Science, patients with osteoarthritis showed improved mobility and reduced pain after 8 weeks of red light therapy. These studies, among others, suggest that red light therapy can be an effective, drug-free method for managing chronic pain. But why is this important? Well, chronic pain conditions like arthritis, fibromyalgia, or neuropathy can be debilitating, affecting every aspect of a person's life. Traditional treatments often involve medication, which can have side effects and sometimes lead to dependency. Red light therapy offers a potential alternative, helping to manage pain and improve quality of life without the risks associated with long-term medication use. Of course, it's essential to remember that while red light therapy shows promise, it's not a miracle cure. Everyone's body responds differently, and what works for one person may not work for another. However, it's an exciting area of research that could bring relief to millions of people worldwide. Several studies have shown the potential of red light therapy in managing chronic pain. Hearing about the science is great, but hearing about real-life experiences truly brings it home. Let's kick off with the story of Mark, a 50-year-old man who had been living with chronic back pain for over a decade. Traditional methods of treatment provided little relief, and the constant discomfort was taking a toll on his quality of life. He decided to give red light therapy a try, and within a few months, he started noticing a significant reduction in his pain levels. Fast forward to today, Mark is able to enjoy activities that he never thought he'd be able to do again, like hiking and playing with his grandkids. Then there's Lucy, a 35-year-old woman who struggled with severe arthritis in her hands. As an artist, this was more than just a physical discomfort. It was a threat to her passion and livelihood. After incorporating red light therapy into her routine, Lucy began to regain the mobility in her hands. She noticed that her morning stiffness was reduced, and she was able to hold her paintbrushes with less discomfort. Today, Lucy is back to creating beautiful art, her hands guided by inspiration, not hindered by pain. Or consider the story of Sam, a professional athlete in his mid-20s. Sam's career was jeopardized due to persistent joint inflammation. He'd tried everything, from painkillers to physical therapy, but nothing seemed to give him the relief he needed. That's when he came across red light therapy. After a few sessions, Sam found that his recovery time after training was significantly improved. Now, he's back on the field, stronger and more resilient than before. And let's not forget about Rosa, a 60-year-old woman battling the chronic pain of fibromyalgia. Rosa had tried numerous treatments, but nothing seemed to alleviate her discomfort. But when she discovered red light therapy, things started to change. After several sessions, Rosa found that her pain had decreased, and she was sleeping better at night. She's now able to enjoy her gardening hobby again, something that seemed impossible just a few months ago. These stories are just the tip of the iceberg. There are countless individuals out there, from all walks of life, who have found relief from chronic conditions through red light therapy. Of course, it's important to remember that everyone's experience with red light therapy is unique. What works for one person might not work for another. But isn't that the beauty of it? The potential for finding a solution that fits your unique needs. The common thread among all these stories is hope. Hope for a life less hindered by chronic pain. Hope for an alternative to traditional treatments that often come with undesirable side effects. And hope for a future where managing chronic conditions doesn't mean having to compromise on the quality of life. Red light therapy is more than just a treatment. For many, it's a lifeline. A beacon of light, quite literally, in what can often feel like a never-ending tunnel of discomfort and pain. In sharing these stories, we aim to inspire and reassure you, to show you that you're not alone in your struggle with chronic conditions, and that there are alternative therapies out there that have the potential to help. These stories show that red light therapy can indeed make a difference. But don't just take our word for it. Listen to the voices of those who have walked the path, who have seen the results, and who are living proof that when it comes to managing chronic pain, Sometimes, all you need is a little light. So, how do you incorporate red light therapy into your daily routine? Well, the good news is that it's not as complicated as it might sound. This therapeutic technique can be easily integrated into your everyday life, and it doesn't require a lot of time or effort. Let's break it down. Firstly, let's look at frequency. For most chronic conditions, consistency is key. It's generally recommended to use red light therapy every day, or at least several times a week. But remember, it's not a one-size-fits-all solution, so it might take some time to figure out what works best for you. Next, let's talk about duration. Each session of red light therapy typically lasts between 10 and 20 minutes. That's right. You could potentially experience relief from chronic pain in less time than it takes to watch your favorite sitcom. And the best part is that you can do it while reading, watching TV, or even drinking your morning coffee. Now let's consider positioning. The light source should be placed in close proximity to the skin, about 2 to 6 inches away from the targeted area. This allows the red light to penetrate the skin and reach the cells below. It's important to note that the light should never cause discomfort or pain. If it does, it's a sign that you should adjust your positioning or the intensity of the light. There are different types of red light therapy devices available, ranging from handheld units and lamps to full-body panels. Handheld devices are great for targeting specific areas, like a sore knee or an inflamed shoulder. Lamps and panels, on the other hand, can be used for more generalized conditions or for treating larger areas of the body. When choosing a device, there are a few things to keep in mind. Look for a device that emits light in the appropriate wavelength range, typically between 650 and 850 nanometers. Also, consider the power output of the device, as this can affect the effectiveness of the treatment. Now, let's address one of the most common questions. Can you use red light therapy too much? While red light therapy is generally considered safe, overuse can lead to diminished results. It's a bit like exercise. While it's beneficial to work out regularly, overdoing it can lead to fatigue and decreased performance. As always, it's best to listen to your body and adjust your regimen accordingly. It's also important to note that while red light therapy can provide relief from chronic conditions, it's not a cure-all. It's best used as a complementary therapy, alongside other treatments recommended by your healthcare provider. Lastly, it's worth mentioning that the effects of red light therapy are cumulative. This means that consistent use over time can lead to more noticeable results. So, don't be discouraged if you don't see immediate changes. Stick with it, and you could see improvements in your symptoms over time. With the right approach, red light therapy can become a part of your daily routine. And who knows, it might just be the key to unlocking a more comfortable, pain-free life. As with any therapy, it's important to keep safety considerations in mind. When it comes to red light therapy, or any new health regimen for that matter, it's crucial to have a chat with your healthcare professional first. They know your medical history, your current state of health, and they can best advise you on whether this therapy is a suitable addition to your wellness routine. This is especially important if you're currently undergoing treatment for any chronic condition, or if you're on medication. Now let's talk about contraindications. These are conditions or factors that serve as reasons to withhold a certain medical treatment due to the harm that it would cause the patient. For red light therapy, there aren't many, but they do exist. For instance, if you have certain eye conditions or are particularly sensitive to light, you'd want to take extra precautions. Also, it's generally advised to avoid direct exposure to light therapy on suspicious or cancerous lesions. It's also important to mention that while red light therapy has shown positive results in many cases, it's not a magic bullet. It may not work for everyone, and it's not meant to replace traditional treatments but rather to complement them. So, don't ditch your prescribed medications or other advised therapies without discussing it with your healthcare provider. Moreover, remember that patience is key. Healing takes time, and so does the effectiveness of red light therapy. It's not unusual to see gradual improvements over weeks or even months of consistent use, so don't get discouraged if you don't see immediate results. And finally, make sure you're using a device that's FDA approved, from a reputable manufacturer. With the rise in popularity of red light therapy, there are many products on the market, but not all of them meet the necessary safety and quality standards. Remember, while promising, red light therapy is not a one-size-fits-all solution. So, as we journey towards better health and pain relief, let's do it safely, responsibly, and with an open and informed mind. To sum up what we've discussed today, chronic conditions like arthritis, joint pain, and inflammation can indeed be challenging to manage with traditional treatments. This is where red light therapy might offer a promising alternative. It works on a cellular level, using specific wavelengths to stimulate your body's healing processes. We've heard real-life success stories from individuals who found relief through red light therapy. They've shared their personal journeys, showing us how this therapy has improved their quality of life. And while it's not a one-size-fits-all solution, incorporating red light therapy into your daily routine could be a game changer. It's all about finding what works best for you. Remember, it's crucial to consult with healthcare professionals before starting any new therapy. They can guide you on the duration, frequency, and positioning of the light source for your specific needs. We invite you to share your experiences or questions in the comments below. Thank you for joining us on this journey into the world of red light therapy. We appreciate your time and curiosity in exploring alternative pathways to managing chronic conditions. It's a vast and fascinating field, and there's so much more to discover. If you found this video insightful, do consider subscribing to our channel. We regularly share content on health and wellness, and we'd love to have you as part of our community. Together, we can delve deeper into the science of well-being, demystify complex therapies, and celebrate the power of the human body to heal. For those of you who are keen to dive further into the topic of red light therapy, we've provided links to some additional resources and studies in the description below. These will offer you a more in-depth understanding of the therapy's potential benefits and applications. Stay tuned for more insightful videos, and remember, your health is in your hands.